Namaste and welcome to CeRIMed Talk. We are very happy that we have a very special guest, Dr. Samrat today to talk about a very interesting topic. First time CeRIMed Talks is handling. So be patient for a few minutes. We are expecting much more number of people will join, and once maybe another 5 minutes time we'll start the actual talk. So be with us, you get ready and settle down. We'll be talking, I'll be introducing the speaker and we'll tell what is CeRIMed and what we do and connected things. Then we'll go all the way and hear the ADHD, the myths and misconception, the very interesting topic, which first time in CeRIMed platform we're handling, especially for the children. We never done that particular type of audience, any talk on that. So we're going to start today. Normally we do on Zoom, but today because of the good interest on the Facebook Live, we are coming live also on Facebook. And you can see also on YouTube, if you have YouTube connections, you can see this talk in case you have a problem with the Zoom. So I'll wait 1 more minute before our scheduled time starts. After that, I'll be giving a brief about CeRIMed, because CeRIMed is a very newborn organization, just started about a year back. And what we do, why we do, and how we do it at present. So this talk will be about 30 to 40 minutes. And towards the end of that, obviously, you'll have a chance to ask questions, whatever level you have, either beginners, because the topic is so popular among some section of the people. So you may have a great lot of inquiry on this subject. So our speaker, esteemed speaker, Dr. Samrat has a very specific interest to talk about this because it's not very well understood. So that's why so many myths and misconceptions persist. And hopefully most of those get clarified at end of the talk today. So it's 6 o'clock. Namaste and welcome to all our participants today. And we are very happy to start our CeRIMed talk on ADHD myths and misconception. ADHD is, by the way, is attention deficit hyperactivity disorder, as one of the very popular acronym today, because as the world is getting very complicated, people may not have time to even tell the full form. So it's happening for many of the cases. And I see people using many acronyms. This is one of the acronym with specifically addressed to the children, but with so much of distraction in the world today, I think regular people also have a lot of attention deficit, may not have hyperactivity and behavior problems. So it's a very interesting topic. We all waiting to hear Dr. Samrat what he has to say from US. And before I introduce our esteemed speaker, I'd like to tell few words about CeRIMed. CeRIMed is a voluntary research organization. We started about a little over a year back, a Center for Research in Integrated Medicine. And it's a agglomeration of various professionals who has a common interest who serve the society and which deals with the various streams of medicines. And because we know the healthcare or any kind of disease normally address either by allopathy, by other medicines, but we find there is a lot of alternative and integrated option exist. And our proposition is to explore those and find out what is the research scope and validate those. So in that respect, we started bringing the awareness among the people for more than a year with a prominent speaker, starting from Dr. B.M. Hegre, who spoke last year on April. And after that, we have many other speakers, both from India and US, talked about many of those current recurring problem, both on physical and mental level. Today actually is a talk which will address mostly on the mental level confusion people have. So, but specifically for the children. So in that way, CeRIMed is a platform where we are addressing today this issue. And we have a supporting group for which we are very thankful, and that group name is Reach Healthcare. These services actually they support us with their team of people, with their technology, and you can see this video which will talk briefly for a few minutes what Reach Healthcare they do, and that's how this CeRIMed is supported by these healthcare services. A small presentation on Reach Healthcare. Some speaker, the volume, please. Okay, so that's is Reach Healthcare, and we do many other things. And one of our recent activities, almost a year now, is on IWSP, which stands for Integrated Wellness, Science and Practice. It's actually, as we talk about integration in CeRIMed, this is we talk, but what we practice, which brings the another level of integration, bringing the science and practice. And the small introduction on IWSP. Please watch this video. Yes, that's our very much one of the major activities currently, and I'm happy to announce that our next batch is starting next month, July 16 to be precise. You can go to this site mywsp.com. You'll see more about what we do with that and how you can join and attend all those important things, which brings wellness both at an integrated way, and you can practice along with us over a month. So it is very happy to, and I feel very privileged to talk about our esteemed speaker now. And on that respect, I'll tell that this is one of this final CeRIMed talk of 2021, where Dr. Samrat Das agreed to give this talk before we run out of this year. And he's a director of undergrad medical education from University of Duke. Medical Center, and he's also associate professor of pediatrics. And interestingly, he's also president of American Federation of Medical Research. So research is such a common thing. We see the connection with him and his interest to give us a talk. We are very fortunate. Briefly speaking, he he is actually did his basic medical degree from Government Medical College, Nagpur, and after that he did his Doctor of Medicine from New York Medical College. After that, he's spent quite a good number of years in University of Nevada, Reno, where he started his the practice, and currently he is, as I mentioned before, as a Duke University School of Medicine. He's there and is at having the multiple hat. So I find the doctors, especially, is so busy, and they have very little time for research and publication. But I'm surprised to see when I was looking at his profile, so much of research activities involved not only conducting research but also reviewing articles, abstracts, even participating in many of these committees. I mean, it's difficult to see this level of commitment to this field of interest in pediatrics. So we are very fortunate to have you, sir. And with this few comments, I request now our Swamiji, who is one of the key front bearers for IWSP and CeRIMed, many other activities. I request Swamiji to tell a few words about our esteemed speaker. Over to Swamiji.
Namaskar. Good evening. A warm welcome to all our esteemed participants who have joined us this evening. Reach Healthcare, CeRIMed, IWSP. Together, we are here to bring something unique, scientific, practical, and useful for all of us. When I say this, the first priority that comes is the health. If you are maintaining a good health, physical, mental, and emotional, if you are in a good condition, we can do wonders. We can achieve whatever we want. To get all the success, to make all the achievements that we dream of, we need to learn about health. How to maintain our health. What is health? Actually, health and wellness. Keeping this as a focus, we team of volunteers are working together to bring and present the best to our people who are with us. So today is a great day where we are going to listen to Dr. Samrat Das, who is a well-known pediatrician, a researcher, a good teacher, above all, a good human being. The moment I say a good human being, what makes you to say? As we know, Swami Vivekananda always focused on one thing, that is man-making. If you focus on man-making, you are able to go and build the nation. Man-making and nation building. This was the emphasis which Swami Vivekananda always stressed. So when we say man-making, what makes a man great? Swami Vivekananda says, men and women of great character. So what is the basis on which we say is a great man or woman? Based on the renunciation, tyag or seva. The more you are able to sacrifice your comforts for the welfare of others, you are a good person. Person with a great character. So, Samrat Das, being a very good doctor, I said he's a good human being because he has studied Swami Vivekananda. he practices the principles, renunciation and service, tyag or seva, giving up our own comforts and coming out and taking all the challenges to help others. That's what tyag or seva, sacrifice and service. So I have seen a bit of sacrifice and service when it comes to Samrat Das. He joined our IWSP team during this COVID-19 times. He volunteered himself, being a busy pediatrician, to give online consultation to people whenever they required. So in this brief introduction about Samrat Das, with his great academic performances, his great career, professional experience, I appreciate the attitude of service. He is always ready to serve. So again, today also, he is going to give his best service to our community by talking all about ADHD. Attention Deficit Disorder, we know. Attention Deficit Hyperactivity Disorder. Very interesting topic. Rather than I speak on the topic, I would like to listen to Dr. Samrat Das on this useful topic, which will be very useful for all the parents to take care of their children. So with this brief introduction about Dr. Samrat Das, now I welcome Dr. Samrat Das to come over and talk on the given topic. Welcome, namaskar to all.
Pranam Swamiji, and thank you for the kind introduction, and more importantly, thank you for all your guidance. Whatever I try to do is because of Thakur and Ma's blessings, and whatever I've learned from you all. And thank you, Shubhrotada, for inviting me, and Anirvanda and Parmeshji. Let me share my screen. So for the next half an hour or so, what I will do is talk about attention deficit hyperactivity disorder, and basically, we'll give a brief introduction. I mean, this is a huge topic, and there are numerous aspects to it, but at least try to give you a brief introduction, and most importantly, hopefully increase awareness of this. The goal is here, give this talk. I know there will be a recording of this, and then hopefully, if you all like, and if you think that this is something that others could benefit from it also, just feel free to forward the recording. The whole goal is to increase awareness amongst the society, amongst parents, so that these children do not go unrecognized and untreated. And good evening to all of the other, people who came in to join today, and some of my friends and relatives have also joined in, I see. So thank you for doing that. With that, I'll get started. So I'm an associate professor of pediatrics at the Duke University School of Medicine, and currently the president of American Federation of Medical Research. Those are my only disclaimers. I have no tie-up with any pharmaceutical company. So all of the medications that I will talk about, I have used generic names for the medications. I will not use any trade name for any of the medications, so that there's no conflict of interest there. So it is one of the most common neurobehavioral disorders of children, and it can profoundly affect the child's academic achievement, well-being, and social interactions. And why is that? Why is this topic so important? It is quite common, and we just do not realize that. And academic achievement, all of the parents who are here, and including myself, we all know how important it is for us, for our child to perform well academically. And why is that? Number one, we want them to gain the knowledge. Number two, especially in India and across the world, that is the best wealth they can have other than health, like Swamiji mentioned. If you have good education, then you are, you're going to have a good life, and you're going to be a person in the society who is contributing to the society's well-being. So it is very important that they fully achieve their academic potential. And then with that comes their own social interactions, their place in the society, their own well-being, their family's well-being. So many things that are interrelated. And if you have a disease that is impacting all of this, and especially when you are a child, so imagine the plight of the parents and imagine the plight of the child. And this is like completely destroying the child's life. So so whatever we are going to talk about today is basically going to apply to children between 4 years and 18 years. Adult ADHD is also common. I will briefly talk about that, but I'm myself a pediatrician, so I'll mostly focus on the children. Now, there was a recent meta-analysis, meaning a search of all of the literature across the world, and to look at how common this is. And this was seen among 7.2% children across the world. So we're talking about 7 children out of every 100 children. That is very, very common. Now, there have been some other estimates based on some community-based samples, and they were even higher, between 8.7% to 15.5%. So that's very high. If you have every 15 children out of 100 children with ADHD, and we are not recognizing them, imagine how unfair we are being to our children and to the future of our countries and to our families and society. There was actually a study done in Coimbatore area that is published, and they saw, at least in that area, the prevalence was even higher than the global estimate. It was close to 11%. And what was particularly disturbing was that it was even higher in the lower socioeconomic group. So it was close to 16%. And the highest prevalence was seen in age 9 and 10. Around that, almost quarter of the children had some form of ADHD. That is huge. So this was a study done in the Coimbatore area, and this was published. You can look it up. So it's definitely more common than we think. So why am I talking about this topic today? I'll share a story of a patient, and I have spoken to the patient and their family and got permission to share their story with you all. This is a 15-year-old patient who was unfortunately admitted to the hospital because she tried to commit suicide. And okay, someone says volume is very low, unable to hear. Can you hear me better now? Can you hear me better?
Yes, doctor, I think you're perfect. No problem. Please carry on.
Okay. So I'll try to be a little louder. So this 15-year-old who had attempted to end her life, imagine a 15-year-old teenager with all her future, there, and she trying to commit suicide. Imagine the plight of her parents. And so I go to see her with my students and my residents. We have a large team that see the patient, and I talk to her and try to get through her, and obviously completely flat. This absolutely no response, and all she says is I'm fine. And then I went back. I thought it was a large team. She's not going to talk to me with so many people. So I talked to, I went back in the afternoon and said, let me give some time to this student, this child. And I sit down with her and tell her, you are exactly the age of my elder daughter, so eldest daughter. So you are like my daughter, and I see my daughter in you, and that's why I want to talk to you and see what's going on, how I can help you. Then she started. I finally got through, and she started talking about what exactly happened, and she goes, it all started around age 6, where in the school she had little weird ideas, but she was ahead of other people. One day she asked the teacher, teacher, the dogs also have babies, and do the dogs get married? That was her question. And she was scolded so much for asking that question. And she said, I just asked that question because it just came to me. I just blurted whatever I had in my mind. And then she goes, I, from that day onwards, I felt that all of my other students in the class, they could somehow say the right thing at the right place. And I just could not. And it was a struggle for me to say the right thing at the right place. And it just kept getting worse. And she would blurt out answers when she was frustrated. She could not, concentrate, and grades getting worse. And then she slowly started feeling that happiness is not something that is for her. She started feeling that happiness is something for everyone else in her class and not for herself. And it got to a point where she said that there is no point in living this life because, I am never going to be happy. So this is a child who was a little different. And this is a child who was actually ahead of the other people. She had different thinking. She just didn't know when to say what. And super intelligent child, grades falling, she thinking that she's so much inferior to other people and wanting to end her life at age 15 and now in the hospital. So this is, one of the stories. And then I asked about her parents and her support system. And she absolutely had a great support system. Her parents are wonderful. Not only parents, she also has grandparents in her life, and they all are very, very supportive. So in spite of all the support, at least from her family, this is her plight. She is wanting to end her life. So imagine all of the parents who are unaware of this diagnosis and not willing to support their child because of a lack of understanding what is going on. They think it's a discipline issue, it's a behavioral issue. And it is a behavioral issue, but there is a reason for it, and that is it's a reason which could be treated very easily. So imagine the plight of those children, and we are talking about 10 to 15 children out of every 100 children. So this is a massive problem, and really I hope that we are able to increase the awareness of it and the ways to diagnose it and treat it. So with that, and I've had many such children in office and in hospital, and this is just one of them that I shared today to kind of emphasize the importance of recognizing this problem. So these symptoms mostly occur in childhood. They all start in childhood. However, some people can actually continue to have the symptoms and some form of functional impairment throughout, like their adolescence, which is when they're teenagers, and then into adulthood. About a third of children continue to have ADHD as adults. And again, that's again a disaster, because that's a problem for their work, for their career, for society, for their family life, relationships. It's a huge problem. So the median age of diagnosis was about 7 years, according to a study. And about a third of the children were diagnosed before 6 years of age. Now, this data is mostly in the United States, so where definitely there is more awareness of this disease. Not, definitely much more than a lot of other countries. ADHD awareness is there. The Western world is definitely more aware of this diagnosis. There are not many studies in India to look at how many children are being diagnosed correctly and being diagnosed early on. In the beginning, when they are children, they're mostly hyperactive, they're very impulsive, but as they grow, they're not as hyperactive or impulsive. It's more of they withdraw themselves. They have more problems with giving attention. So like I mentioned about the child who was admitted under my service for a suicide attempt. She was more of the depressed kind now. So they start out with being very hyperactive and very impulsive, and then slowly withdraw themselves and get more towards the depression side. Okay. So please feel free to put in the chat box if you have questions. I know we talked about taking questions at the end, but I'm happy to elaborate on something that is not very clear, and if they have a question, if someone has a question right this moment. So not only the ADHD is a problem, but ADHD is also associated with some other learning problems. Like they may have issues with writing, they may have issues understanding math, they may have some issues reading. So there are some associated learning problems with this also, and there are sometimes language problems also. And it has been seen that all of those get better if you treat the ADHD, and that's the important part here. Boys are in general more than twice as likely as girls to receive a diagnosis. Part of it is, we all know boys tend to be a little more mischievous than girls, so it becomes a little more obvious, and so boys are usually diagnosed early on and are twice as likely to be diagnosed. Majority of the boys and girls, and we are talking about boys and girls, we're talking about children here, with ADHD also have another mental disorder. So it's very important, if you're thinking about ADHD, there could be another mental disorder that you should try to, if there are physicians here in the room, they can also share their perspective. But there's a lot of other mental disorders that are associated with ADHD that we should be on the lookout for as physicians. So boys are, again, they could have more like oppositional defiant disorder, and something like anytime you say something, they would do exactly the opposite to it. They just won't agree to what you ask them to do, some form of conduct disorder. So they are more likely to have those kind of issues. And then in girls, it's more like anxiety and depression. So in boys, it's mostly oppositional defiant disorder, conduct issues. In girls, anxiety or depression. And we are talking about comorbid condition, and a condition in addition to ADHD. So these things could be there in addition to ADHD. So moving on to the diagnosis. So who can diagnose it? It could be a psychologist, a child psychiatrist, or a pediatrician. So any of those people could diagnose ADHD. Anyone 4 and above, we typically do not diagnose someone with ADHD if they're less than 4, because in general, we say younger the child, the more active they are. We say they're chanchal, right? So we don't want to label them as ADHD when they're very early on. They could be just that chanchal phase that we say this child is very chanchal or very active, and so we don't diagnose with ADHD in children who are less than 4 years old. And then, so it's between 4 years and 18 years, and especially if you have a child who comes in with academic or behavioral problems, or they are having issues focusing, or they are a little hyperactive or impulsive, suddenly they will do something even though that's not the right time to do it, and they become very impulsive. That is when you should seek attention of a qualified doctor. So if there is one take-home message from this talk, is if you know anyone, your own child, your niece or nephew, your neighbor's child, if you're a teacher, very important, teachers have a big role in this, to recognize this. If you have someone who has academic problem or some behavioral issue, and if you think that they're not able to focus, or they're a little impulsive or hyperactive, think about ADHD. That is one big takeaway I want everyone to have from this talk. If you have a child who is struggling academically, think about ADHD. It's a very common thing, and you can diagnose it, and there are ways to diagnose it, and you can treat it. So what are the specific diagnosis criteria? So it comes from the Diagnostic and Statistical Manual of Mental Disorders. There are version of it. Right now it's the DSM-5 version criteria. And so what you need to have is, and we'll talk about those symptoms. And so worldwide, there is DSM-5 criteria are being used, or a version of it. So depending on the cultural aspects of that country or of that region, people have developed a version of these criteria. So All India Institute of Medical Sciences in New Delhi, which is considered the premier medical institution of India, along with others, but that when that comes to the forefront, it's the premier institute now. So they have come up with their own criteria based on the DSM-5 criteria, slight modification. This is just giving an example. I'm not asking anyone to just use the AIMS criteria, but just to give you an example how people have adopted these criteria that I'm going to talk about based on the regional needs and the cultural needs. But basically, they're the same. So what you need is, you need to have those criteria that I'm going to talk about in the next few slides, but it has to be there in more than one setting. So if only the parent is observing, but the teacher is not observing, or if the teacher is observing, but the parent is not observing the same behaviors at home, you cannot diagnose ADHD. So, and that's important. Then that's where the role of parents are there, and the role of teachers is very important, because we need the input from teachers to diagnose this. We need the input from parents also. So it has to be very important. The criteria have to be met in more than one setting. Okay, so for students, it's mostly the school and at home. So, and then also we need to make sure there's not something else. So that you got to have a very thorough evaluation of these children. I mean, you need to make sure there's no other mental health disorder going on. I mean, someone may just have schizophrenia, someone may have major depression. So you need to make sure that you're ruling out all those things and not saying ADHD, because the treatment is so different. So and then the last thing is, not only you should see those problems in more than one setting, but it is to the extent that it is interfering with their functioning, meaning it is academically they're it's a problem. Socially, it's a problem, or they're not developing as expected. So it has become a problem. So to diagnose ADHD, you have the DSM-5 criteria or a version of it across the world. You need the symptoms in more than one setting, not just one setting, either both the school and the home. And then the symptoms should be to the extent that it is actually interfering with the functioning or development of the child. So that's how you diagnose ADHD. Now, there are different types of ADHD. So you could have inattention, where if you have, you may have children who are mostly inattention. So what are the different there are 9 symptoms of inattention that you have to look at. And if you have 6 or more, of these 9 symptoms, then you can diagnose someone as ADHD inattention type. So what are the symptoms? They often fail to give close attention to details or makes careless mistakes in schoolwork, at work, or with other activities, often has trouble holding attention on tasks or play activities, often does not seem to listen when spoken to directly, often does not follow through on instructions, and fails to finish schoolwork, chores, or duties. They lose focus, they get very easily sidetracked, often has trouble organizing tasks and activities, often avoids, dislikes, or is reluctant to do tasks that require mental effort over a long period of time, often loses things necessary for tasks and activities, like they will forget school materials, pencils, they're very disorganized, forget their glasses, they can easily get distracted, and is often forgetful in daily routine activities. So these are the 9 inattention type or lack of enough attention type symptoms. And if you see 6 or more of these symptoms at both school and home, that student has inattention type ADHD, and it is impairing their functionality, their academic performance, and they don't have any other mental disorder going on, then you can diagnose ADHD. There is one more thing. If you pay close attention to this slide, everything I put in often. So it is very important that it is not once in a while symptom. If you see often or very often, 6 out of these 9 symptoms, very often in 2 different settings, then you say ADHD. As much as I want to increase the awareness about ADHD for early diagnosis and treatment, I also do not want to give an impression, and I don't want in any way to overdiagnosis. That's why I'm saying it is very important that we pay attention to these things. 2 settings minimum. It should impair the functionality, and it should be seen very often. We don't want a situation, and I've had those also. I've had Indian parents, or other parents who have come in because their child is performing exceedingly well, but they think that, it's not focused enough. Right now he's in math count. He last time did state, so I want them to do nationals. I think there's a little bit lack of focus. Can you, doctor, give that stimulant medication for ADHD? And he or she would just crack it this year. No. That is not what we want to do to our children. That is normal. That child is already performing to the extent that that child is almost ready, doing math at the state level, and you want them to go to nationals, and you think that the difference between going from state to national is the child is not focused enough. No, that's not ADHD. We're not talking about those children here. We're talking about children who are having real issues academically, real issues with behaviors, getting scolded everywhere, having problems, having problems creating relationship with other friends. And you're seeing that both school and home. Those are the children we are talking about. So it should be seen often, more than one setting, and then it should be impairing their functionality and development. Okay. So then the other type is, the first type was inattention, or they're not able to focus as much, and the second type is hyperactivity and impulsivity. So these are 9 symptoms. If you have 6 or more of these in 2 different settings, for students, home and school, and it is creating a problem for the child's development and functionality in academic performance, then, and it is happening often. Again, if you pay attention to the slide, you'll see I've written everywhere often. Sometimes no. If it is often, yes, you can diagnose the child with ADHD. So hyperactivity type. So what are those symptoms? These children often get fidgety or tap their hands or feet or squirm in a seat. They often leave the seat in situations when they are supposed to be seated, often runs about or climbs in situations where it is not appropriate, often unable to play or take part in leisure activities quietly, is often on the go, acting as if driven by a motor, that like so much energy, always on the go. Sometimes talking excessively, get in trouble at school and at home, and socially. Often they cannot hold themselves. They would blurt out an answer before the question has been completed, and they would not raise hands. They would just blurt it out, and they would not wait their turn. And if someone else is talking, they would interrupt or intrude. So these are some of the hyperactive symptoms. So if you have 6 or more of these in 2 different settings and very often, and it is creating problem for the child, you can diagnose that child with hyperactivity type ADHD. So for adults, I said I was going to briefly talk about it. The diagnostic criteria are kind of similar, but you need 5 or more. So you don't need 6 or more, you need 5 or more. For adults, it would be more in the setting of their work environment and society or at home. So if you have these symptoms, 5 or more at more than one setting, and very often, it's very important. If it is quite often, then you can diagnose with hyperactivity type ADHD. All right, so and again, there must be some other criteria also. Like I mentioned earlier, this is a childhood disorder. So if you have an adult you think has ADHD, that actually started when they were a child. It did not start now. So it sometimes gets untreated and sometimes follows into the adolescence and as adults, but does not start as an adult. So you need to diagnose this. You need to make sure that there were several symptoms before the age of 12. And I already mentioned, emphasize the need to have it in more than one setting, so at least 2 settings, and then there should be a clear evidence that these are actually interfering with the child's quality of life, social activity, school and work. So most important, work and school and home. And very important, it's very important to do a thorough evaluation, make sure there's nothing else going on that could explain this symptoms. So there's not another mental disorder like mood disorder or anxiety issues or schizophrenia or personality problems. You want to make sure that the child does not have any of those. And so if a child, sometimes 14, 15 years, I have, we've seen schizophrenia in as early as 14, 15. So you want to make sure that, if they're having a bad time for the schizophrenia, and if all of the symptoms are during that, that's not ADHD. Last but not the least, about diagnostic criteria, this should have been there for 6 months or more. All of the symptoms that we talked about to diagnose ADHD. I see that there are some questions on the chat. Do I need to address those now, or we can just go over all of the questions at the end?
We can go at the end. So I will moderate those questions once you finish your talk.
Great. Thank you. Yeah, I just want to make sure that everyone's questions are answered. So, like I said, we want to make sure that these symptoms are there for at least 6 months. We talked about, predominantly inattentive presentation or predominantly hyperactive presentation, different set of symptoms, but still need 6 out of the 9. And then you could also have a combined. So if you have like inattention type plus hyperactivity, each of them 6 and more than 6 months, then that's called a combined presentation. So that's a mixed type. So you can have inattention ADHD, hyperactivity, impulsivity ADHD, or you could have combined. So 3 types. All right, now comes the ADHD treatment part. So the treatment of ADHD, the most important thing, of course, is to diagnose correctly. And we talked about some of those criteria. And again, this is more of an introductory talk. Happy to, give, more detailed view of ADHD at a later time. So if you have a child who is less than 6 years, so we said less than 4, I don't like to label them as ADHD, but 4 to 6 years, you could. So if you have a child who is less than 6, but above 4, and then they meet all of the criteria that I just talked about, and you diagnose them with ADHD, for these subset, preference is behavioral therapy. So how do you do the behavioral therapy? You do not train the child. You meaning if there are physicians sitting here, including myself, other healthcare providers, we don't directly give the behavioral therapy to the child. Why not? Because a child less than 6 years is not going to listen to you and me. It's going to listen to their parents. So what is important is to train parents in giving that behavior management therapy. So you make sure you talk to the parents. If parents, you tell them how to discipline their child appropriately, how to reduce distractions at home. Just to give an example, if they have a study room, make sure there is not a lot of noise, the television is not close by, people are not watching television loudly when the child is trying to study. You have a child who has a problem with impulsivity, who has a problem with focusing. How will that child study if you are not even making sure that there is not enough there's not too much noise around that child? So basic behavioral stuff. But this is not the age group. I would recommend you bring them in to a psychologist, and the psychologist is giving the behavioral modifications the child knows. The recommendation is you get the parents in and tell them and train them how to manage these children at home. So it's very, very important that the parent training in behavior management is the mainstay of treatment for the children who is less than 6 years old. If it is absolutely not working, of course, you need to have the teacher support. And and it keeps saying that it's so important to increase awareness about this, not only amongst parents, but teachers. If these children get in trouble at school, we know that. I mean, of course, they get in trouble at home also, but they get in trouble mostly at school. And if the teachers are not aware of this diagnosis of something so common like this, then of course, we are not doing any good to our children. So it's very important that we increase the awareness amongst teachers as well. So it's important you got to do some behavioral modifications at school, you need to have special attention for these children. You need to have a special plan for these children. And you have to know what to expect from these children. So recognition, what to expect, then only you can do certain behaviors at school, which is not easy. I know that. Now, so like I said earlier, these children are not mature enough to change their own behavior without their parents' help. So you want to get the parents involved. So if it is not working, the behavioral management, then the medicine that is recommended at this age group, less than 6 years, is methylphenidate. It's a stimulant medication, and the child usually has a complete turnaround. 80% of the children show great results with methylphenidate. So, but for this age group, I would first start with parent training, and if it's not working, then give medication, because the side effects of methylphenidate are higher. And as Swamiji mentioned earlier, whole overall wellness is very important. I mean, if you are giving the right environment, and that includes emotional and spiritual well-being, that's very important to introduce all of those at home and have those things at home that helps the child. So versus not being aware, not paying attention to spiritual well-being and emotional well-being at all, that is not the environment which is conducive to these children at all. Swamiji, you wanted to say something?
Yeah, it's very nice to listen to you, and I really appreciate the way you presented. Very difficult topic to present. I think all our participants really followed what you spoke. And where you are asking me to speak about the overall wellness, yes, it is very vital. And that's where the future of health, if somebody wants to know, we have to understand we should have an integrated approach for health and wellness. Recently, I'm one of the working committee members for wellness. I'm one among the 20 members, which is by Central Government of India, Ministry of Health and Family, where we have been discussing about the importance of integrated wellness and how it should be incorporated, especially in the adolescent group. And when it comes to health, yes, exactly as you mentioned, physical, mental, emotional, and social well-being of a person.
Okay.
So if somebody wants to enjoy the physical, mental health, he should be emotionally stable. He should be in a good society where he gets right support to develop good emotions. That can happen only when the child, boy or girl, is given a proper environment, which is the spiritual environment. So it's a big topic. Subratoji and Irban, they will speak about how IWSP, CeRIMed, Reach Healthcare, working voluntarily to develop a module for all age groups, for our children, parents, teachers, everybody. We have developed a module, and spiritual environment is very vital. So we should have a spiritual environment at our home. We should provide a good social environment where the boy or girl will develop right emotions. And those right emotions should get a right direction where they will be presented with their behavior. So that much I want to comment here when you ask about integrated wellness. Please carry on.
Yeah, thank you, Swamiji. So that is important, especially for all children. We'll talk about it. So let's go on to the next stage group. So we talked about less than 6 years, and we said the mainstay of treatment there is parental training on behavioral modification of the child. It's important to have overall, pay attention to the spiritual and emotional aspects as well. Very, very important. It's part of it. If it's not working, then we can try methylphenidate. And as I promised earlier, all of the medications that I'm going to talk about, I'm going to use the generic names, the actual formulary. I'm not going to use any brand names of any pharmaceutical company here. So from age 6 to 12 years with ADHD, the recommendation is to actually prescribe approved medications like methylphenidate, dextroamphetamine. Those are considered stimulants. And there are some non-stimulant medications also like atomoxetine, guanfacine, and clonidine. Those are non-stimulant medications along with parental training on behavioral modification. So in this age group, I want to emphasize again, so it is medications with behavioral therapy. It is not just behavioral therapy. And I'll tell you the reason. The reason is that these children, only behavioral therapy works. I'm not saying it does not work. It does work, but combination has been shown to be the most effective. And we are talking now 6 to 12 years. We are talking about, 5th grade, 4th grade, 6th grade. So if we lose control of the symptoms, we would lose critical time. So it is very important that we need to act urgently on these kids and start them on medication and continue with all of the behavioral therapy, plus very, very important emotional and spiritual well-being. So need to also address those in the school level, have to be realistic about the class placement, need to have an individualized plan for these children early on when they're struggling. First thing, as I said earlier, recognizing that this child has a problem. It's not just being mischievous for no reason. They are tagged as mischievous children, indisciplined children. There's a reason for it. This child is struggling. We need to recognize, help them, diagnose them, and then provide them with therapy. You have the medications, you have the behavioral therapy, and then you need to make the necessary changes in school, and initially also need an individualized plan. This child is little struggling because of the attention issues. Maybe we need to have some individualized plan for this child. Again, want to be very transparent about everything here so that you can all take the informed decision. There are some side effects. They are not very big deal. So for the stimulant medications, you can have some appetite loss. They can have some tummy pain. They can have some headaches, and sometimes they can have sleep disturbance. And that's why we recommend that they take the medication early in the morning. Once they're done with their sleep, before they go to school, give the medication at the time, because that's where they need the most, because they need to perform, and it's, they don't always have the support system they have at home in school. So usually we give the medication in the morning. There have been a lot of studies to see if the growth of these children, like the height, is actually diminished. And again, being totally transparent, yes, this medication can cause the growth to go down, but it's only 1 to 2 centimeters from their predicted adult height. So if you have a child who was going to be 5'8" tall, we're talking about 1 or 2 centimeters, compared to not treating it. And you can imagine what will happen to that child, and they will not realize their potential at all. So this is very minimal compared to what could happen if you do not treat. Other studies, there was one time a black box warning on these medications, that these medications can cause sudden cardiac death, and that can increase the heart rate and the blood pressure. Now, large scale studies have been done across the world, and now it has been shown that The increase in heart rate and the blood pressure is a very clinically insignificant degree, meaning it increases by 1 to 2 per minute or just a tiny bit of blood pressure increase. However, if you have a child who there is a history of sudden cardiac death in the family, or you have a child who has a history of palpitations, meaning irregular heartbeat, or some form of cardiac issue, you have to be careful in giving this medication to these children. But how many children do we have really who have a history of sudden, deaths from cardiac issues in the family? And we're talking about early deaths, not deaths in 70s. We're talking about 40s, 50 deaths, irregular heartbeat. So those children, you need to be careful. But again, I want to be very transparent as to how we make those decisions. So I will end by saying, I try to give you a very brief overview, but a transparent overview of what ADHD is like and why it is important to diagnose it, and what are the treatment options and the side effects. But however, I'll end by saying, the human cost of undiagnosed ADHD is just incalculable. Broken families, suicides, lost careers, unhappy lives, and unmet potentials. What would that mean for the family, for the society, for the country? So this alone should be sufficient for all of us as a society and for our government to start treating ADHD with the priority it deserves, meaning increasing awareness through these forums, other forums, increasing awareness among parents and teachers for all the reasons we discussed. I will end there to take some questions and some comments.
Yes. Thank you. Thank you, Dr. Samrat Das, for speaking at length on a very challenging topic and brought out some basic aspects, and which most of us not very familiar, but at the same time I saw plethora of questions coming on the chat box. So I'll try to start one by one if you can
Sure.
explain it to me. One is that my child has ADHD and autism, non-verbal. Please guide treatment for ADHD.
No, what is the question? My child has ADHD and autism, and should
Autism,
I treat or not?
non-verbal. Non-verbal. I mean, not speak.
Okay.
So please guide treatment for this.
Okay.
You have.
And obviously, I'm sorry to hear that you're going through this, and obviously with autism and ADHD, like I mentioned earlier, a lot of these children do have another condition, so that makes it very difficult. Having said that, the treatment, if it is indeed ADHD, I will not give advice how to treat your child in general, because I do not know how it was diagnosed. But in general, if you're asking, the treatment for ADHD and autism together is the same as ADHD. So you oftentimes would not give the stimulant medications. You would give more of the non-stimulant category that I said, like clonidine and atomoxetine, guaifenesin, those kind of medications you would prefer over the stimulant medications in patients with autism. And okay,
Thank you. I think yes, I think we should be generic in asking question, or you won't take up very specific diagnostic question, because this talk is not a consultation talk. It's a talk of general giving a guidelines. In that respect, there is another question coming on the chat box. What can be done for older people? Does it become bipolar or something else?
Yeah, very good question. So like I said, 1/3 of the children who have diagnosis as ADHD continue to carry ADHD into their adulthood. So the diagnostic criteria are the same that I mentioned, But instead of the 6 symptoms, you need 5 of those 9 criteria in 2 or more settings and to be impairing the functionality of that adult. If you have those diagnoses, you could treat it as ADHD. Your question about bipolar again has very specific criteria for diagnosis. I will not go into the details of it, but those are very different than ADHD. Yes, they are hyperactivity does not mean bipolar. You feel that you have flighty ideas. Okay, if you look at all the symptoms, they would suddenly have bipolar go through phases of extreme elevation and then phases of depression. And we did not have those symptoms in ADHD. We talked about more of impulsivity, not flighty ideas. We talked about not being able to focus, and there are specific criteria for ADHD. Important thing is, I hear you, it is not easy, to distinguish. Important area is to go to a competent person, and they will be able to distinguish between bipolar and ADHD. And I'm hoping that with this talk, if you have someone, they have diagnosed as bipolar, and based on this talk, if you think that that could be ADHD, bring it up to your physician. That I heard a talk, and a lot of the things that this person has, the person I'm bringing to you, it sounds more like ADHD and not bipolar, and you have the right to bring that up. So yes, you are absolutely correct. Sometimes it could be wrongly being diagnosed as bipolar when they only have ADHD, and the treatment is so much different. The treatment for adult ADHD is the same as children. You can start those stimulant medications or the non-stimulant medications along with behavioral modifications. So the medications are the same if it is ADHD.
Thank you. And there is a follow-up questions from the first questionnaire. Is my child unable to write non-verbal, so no school admission? So that's the situation. So that's another. I think it needs this.
Can help in this. Anirban can help in this.
Anirban, are you there? Maybe he's not right now.
Yeah, they can take the helpline number.
Yes, please contact our Reach Healthcare. We have a very supportive this kind of issue, especially for the special children. You can pick it up on our Reach Healthcare. We'll get in touch with you and see how we can assist. So instead of spending time on this general talk. So there is another question.
Subrata, sorry, I like to answer one of the questions from a pediatrician. Looks like Namita Agarwal, because I'm sure this is relevant to a lot of people. Dr. Agarwal, hello. You asked the question, how can you as a pediatrician help ADHD child in peripheral setting with least resources? Very, very question, and very relevant question for not just India, for across the world. Not everyone has all of the resources that we talked about. As much as I want overall well-being that includes behavior modification, emotional and spiritual well-being, those are important not just for ADHD children, for all of us. However, the mainstay in general for treatment of ADHD is medications. So what I would recommend you do is, there are forms that you can Google that gives you a list of symptoms to check mark for parents and teachers. So you can form, I'm happy to send one of those forms to Subrata, and they could email that to you. That form, you give it one form to the teacher, and you give one form to the student's parents, and let them just check mark that form. And it is a very self-descriptive form. If you have 6 of those that I talked about, in each of those forms, teacher and parents, that patient has, and you don't think there's anything else going on, and the child is struggling academically, you can get them started on the medications that I talked about, along with behavioral modifications. I understand not a lot of resources you have, but basic disciplining things, how to reduce distractions, making sure that the school is aware of this diagnosis so that there is no taboo around this, and those simple things you could do and get them started on this medication. Starting the medications is not, it's not not got a lot of side effects. They will do fine. Sorry, Subodh, I wanted to make sure that that question is addressed.
No, there is more questions. I don't want to tell very diagnostic type of questions we are not able to take. And they can take our helpline number, the Reach Healthcare. We'll post that again, and so that people can get in touch for that. So, but there is another dimension of question is coming, is from Shumana Datta asking, most of the situation doctors suggest ABA intervention for the children with a behavioral challenges. But being an interventionist, I have seen sensory intervention plays an important role to bring regulation in arousal and attention, but the doctors suggest hardly in that direction. So SI intervention, what is your take on this?
What intervention again? Sensory
intervention.
Okay.
SI, in short, it's called SI.
Yeah. Sensory intervention, in general, if you ask me, what are the things that I would recommend, and I'm not going to say that that is the mainstay. It may help some children, but there are, it may help with other mental disorders. But if you ask me, and this is, I think, going to be more relevant for all of the parents and physicians here. So what would I recommend? So first thing I would recommend is creating a routine. Okay, follow the same schedule every day from wake up time to bedtime. These children do well with creating a routine. Organization. Encourage your child to put school bags, clothing, toys in the same place every day so that they will be less likely to lose them. Same place. Do not, these children are struggling with attention. So put everything in the same place. Manage distractions. You got to turn off the TV. You got to limit the noise. Provide a clean workspace when your child is doing homework. Some children actually may learn better if you have a nice, smooth, soothing background music. So see what your child, what works for your child. You got to limit the choices because they get overwhelmed and overstimulated. So you offer choices with only few options. For example, so say if you have to choose between an outfit or that one, or that meal or that one, you got to give a couple of choices. You cannot give like 5 choices to these children. They get overwhelmed. So make sure you do that. Be very clear and specific when you talk with your child. So, you make sure that you are listening to your child by describing what you heard them say. Okay, so if they say something, you tell them that is a way of like telling them how to pay attention. I'm paying attention to what you are saying, and I'm repeating that. And use very clear, brief directions if you want them to do something. If you want them to go and get the school bag, say go get the school bag. If you tell them go get the school bag, go upstairs and get your pen, and no, they are having issues with attention. So brief directions. Okay, then help your child plan, make the complicated tasks into simple tasks, shorter steps, like I said earlier also. And very important, use goals and praise for their reward, for things that are positive. So have a goal list and track which are the positive behaviors and reward them accordingly. Efforts. Don't reward them if they did not do that. Okay, so but have very realistic goals. Small steps are very important. Disciplining is also important. So instead of scolding them, yelling or spanking them, use timeouts. Like say, not going to talk to you for this much time, and remove some of the privileges. If they have a gamepad and you want to give them, if they did not behave the way you, based on the goals, you got to first tell them what is you expect and what you do not. If they did not meet those criteria, then take away the gamepad that day, and then create like positive opportunities, for school, and of course, like Swamiji said, healthy lifestyle that includes emotional and spiritual well-being. So I thought I wanted to give these tips because that will answer a lot of your parents' questions. What behavioral modifications you need at home. I am not, the sensory stimulation is not the mainstay of treatment of ADHD. It is the behavioral modifications that I just talked about, and stimulant or non-stimulant medications. Those are the mainstay of treatment. And remember, this talk is focused on ADHD only. What you are referring to are comorbid conditions with ADHD. There are different other conditions, mental disorders, where sensory stimulation might work better. I'm not saying it's not going to work for ADHD.
So there is one question, specific question on what is the duration of behavioral therapy? Like how long it will go on?
Yeah, very good question again. So, like I said, first thing is to do something. First thing is to recognize and diagnose and start the behavioral therapy. A lot of the stuff that I just said, the behavioral modifications, they are very structured, and things, putting routines, those need to continue on an ongoing basis, meaning till the child gets a lot better or overgrow that. Because why is it a problem? It is a problem because they struggle academically, they struggle socially, for no reason. They're very super intelligent people, and they could do everything that other children can do. It's not a problem unless you do not treat it. So the answer to your question, you continue those therapies. The behavioral modification that I just talked about, you continue throughout their schooling years till they overgrow them. And basic stuff, these are starting things. Once they get into the routine, they do very
well. There are many questions and comments. Obviously, everybody looking forward to that form which you are going to send it to us.
Sure.
We'll circulate and let you know once we find out exactly how it's formed. We'll mail it to you because we have all the participants' email address and phone.
I just put it in the chat box.
Okay, great. So it's already there. This is to the waiting room, so we'll keep it on the main room also. So right now it has come to the waiting room. And there is one question. I am an OT who works with children with ADHD and autism. Sometimes giving them a picture list of following their daily schedule helps them to know what they are supposed to do. So any comment?
Yeah, that's a very good. That what you are trying to do is what I was mentioning, to have a routine or a structure to their day. It's a very good approach.
That's good.
You need very simple instructions for them, one step at a time, rewards for good behaviors, some discipline action when discipline is not yanking, okay, or spanking them. That is not disciplining. But what is good behavior and what is not so good behavior also has to be told to them. You have to first make a list for them. Hey child, these are the things I expect of you, and these are the not so good behaviors, and tell them this is how you get rewarded, and this is how you get disciplined. Be very open and honest to the child. Children like honesty, and and give them the chance, and give them simple instructions, not too much at one time, and reduce the distractions. Try to reduce the distractions.
Yes, I think you covered quite a difficult subject in such a short time, and obviously I can see a lot of specific questions. Again, I'm reminding all our viewers that specific case, please get in touch with our Rich Healthcare. They will support and give you the specific instruction how to proceed from, especially from India. I will see how to handle, but we won't take those because this is already, we are running close to our end time, and I really like to thank Dr. Samrat Das to bringing this new aspects for the children. So far, this is our new experience, how to handle a very, very different dimension of problem which people are suffering without recognizing it. Unfortunately, US has such a huge number of this kind of published data and everything. I just want a few comments because our society, modern society, is not getting so diverse, which we used to have before. But culturally, there is a lot of diversions, even though there is a development. Like take the society like in Japan, is highly advanced, but this is different cultural forum. So do you have any data on Japanese children, whether they also have a similar issues, or your comment?
Yeah, I mean, I don't have a data. I mean, I have not looked up the data specific to Japan, but the worldwide incidence or prevalence is close to 7-8%. And there is no reason that it won't be there in Japan. It's just thing that is there in every place on earth, and either we recognize it or we don't recognize it is the issue. It is about increasing awareness. Definitely there. So we're talking about close to 10 children out of every 100 children. That is very high prevalence. And to answer your question, Shubhrata, I think I know what you're trying to get to. I think what you're saying is with westernization and modernization and its effect, is it increasing? And I would, I would not say so based on the data. And again, the data, a lot of the data came from India that showed that there is increased prevalence amongst the lower socioeconomic strata. So that is the disturbing trend. So that just tells me that it is something, it's just like anyone in this room could have high blood pressure. Okay, anyone in this room could have cholesterol issues. It's, and as long as we see things as they are, it is a thing that is diagnosed. We have diagnostic criteria and we could treat it. So if we are all, if someone in this room has hypertension, is taking blood pressure medication and is fully living their life, what is the problem in diagnosing ADHD in a child and giving them a medication and doing behavioral therapy and giving them the best environment and having them thrive? It's just that we did not recognize this condition earlier, and with increased awareness, slowly this is, more and more children are getting diagnosed with this condition. And so I do not think personally that this is a disease of Western world, or I do not think that this is a disease due to westernization. I think this is a disease which is always there, and a disease that needs to be taken seriously and needs to be treated as any other disease. We should not, the problem is when we try to distinguish between physical disease and mental health disorders, and or just, oh, this problem is a mental, it's a problem for that child, and it's the treatment is just like, it's a medicine and behavioral modification. So we need to come to the mentality where this is something like any other disease that a child can happen. A child can have asthma. They need asthma pump for sometimes their life, sometimes for a few years they outgrow. It is something like that, something that you can diagnose with the right tools. Sometimes you outgrow it, sometimes you carry this into adulthood, but you take the medication and do the behavioral modification, just like a child with asthma is living this and reaching their true potential. Same for ADHD.
Yes, so I think our main purpose, which Dr. Samrat Das brought out, is the awareness on this subject and pay attention to it. So I think you have done a wonderful job to bringing the complexity in a very, very subtle and situational world which we are living now. Actually, in last year, I was surprised two of the countries formed a special ministry to handle it. One is UK, other is Japan. They formed a minister of loneliness. So that's a new dimension of mental health. So that's the grown-up people, but obviously we have less time to even to look at the child because of our other attention. Anyway, I don't think we'll drag the subject anymore on a different dimension. But I really want to thank Dr. Samrat Das for the wonderful presentations. And I request Swamiji to say final words if he like to at this stage. Thank you, Dr. Samrat. Over to Swamiji for the...
At the outset, heartfelt thanks to Dr. Samrat Das for his valuable time. Yes, as mentioned, a big topic, difficult topic, made it so simple and understandable to everybody. And the essence of the talk was, yes, we need to make early diagnosis and give them right treatment by diagnosing right. Along with that, supporting them emotionally, providing them a good environment where they can grow in a better place. So understanding our responsibility is very important when we bring up a child. Talking to the child, understanding the child, explaining what is right, what is wrong, encouraging when they do right, and making them to walk on the right path when they miss the path. So we should be able to understand and find the solutions according to our place where we are, and also according to the situation, the family. So many things count. So that's what I understand, and I definitely feel it's a very useful class we had discussing. And I see still there are so many questions. I request all of them to connect with our helpline number. Definitely they will help you, we assure you. And need be, we may also request Dr. Samrat Das to address once again, maybe in the next month or the next month, whenever it is possible. I leave it to Subrata Das to coordinate with Samrat Das and come up with one more talk, because I'm seeing there are so many questions and so many people are really in need of the right direction. Finally, the main stress is on spiritual environment. So it's a big topic, spiritual environment. When I say, to make it simple, Samrat Das said we should give them a calm and quiet place, a pleasant place. That's what is spirituality. Making our body, mind stable, free from distractions, being within ourselves, which is our real nature. Our real nature is Ananda, Sat Chit Ananda. To find that, we have to go dive deep within. The best way to teach a child is you be the role model. So I request all our parents, especially parents who are asking questions, how to manage a child with ADHD and autism, so many things. So my humble suggestion would be, you should be a role model. You should become physically, mentally, emotionally stable. Then only you will be able to face the challenge. So we have to strengthen ourselves spiritually. We have to find the joy within, happiness within. So again, as Swami Vivekananda has given his clarion call to all the people. As I said, his call was, his main passion was man-making and nation-building. For that, he has given twin ideals, renunciation and service, tyag or seva. So as a mother, you will have to sacrifice a lot when you are bringing up your son or daughter. Similarly, if you have a child with a challenge like ADHD, you have to sacrifice more. So renunciation and service, that is the key for everybody. So especially with parents, with a child with ADHD and other autism-like syndromes, you have to sacrifice more. So that's what spirituality in brief. The more you are unselfish, the more you are ready to serve, you are spiritual. So being spiritual, you create a spiritual environment at your home and working place. And that is part of the treatment when it comes to treat or support a child with ADHD. That's what I understand. This is my final message. Once again, thank you very much. I also would like to request to give his final message to all of us, Dr. Samrat.
Pranam Swamiji, thank you again. No, I mean, my final message is the same. I mean, if you all can help us increase awareness, and I'm sure this is being recorded, and I think this will be, as my understanding is on YouTube, there will be a stream. It is not about anyone here, it is about the disease and the children who are impacted with this. So if we can raise, if you can send me that recording, I will also send that link to people. There were many people who, could not get the link, and I'm getting some messages. They got, confused with the timing between Indian timing and US timing and all of that. So if you can send that link, and so that we can continue to increase the awareness of it. And I've tried my best with Shri Ramakrishna's and Ma Sharadama's blessings to, say whatever I know. And if there is any mistake, please forgive me. Thank you.
Really, we appreciate your humble efforts, and definitely it will help many parents who have joined. And the recorded link will be sent to you soon, and it will help many more people. And Jotobachi Totosiki, as Shri Ramakrishna says, as long as we live, we do learn. And we all have a responsibility to create an awareness about ADHD, try to help the treating physicians, pediatricians for early diagnosis. And also, when you know about ADHD, you can go and discuss with your physician, this is what I am observing. So that's what the responsibility for all of us who have understood a little about ADHD. And in the time to come, we may have many more lectures on this. So now over to Subrata Das.
Thank you, Swamiji, and thank you, our esteemed speaker. And also, I want to thank the participants who came in big number and asked all kind of questions, which are some of them are easy, some of them are not so easy to handle. So we tried our best, but we'll try to address. Please connect with us, our Reach Healthcare line. We'll try to give our possible solution at this stage. With this, I'd like to close this talk sessions. Thank you all of you again. Thank you, our Dr. Samrat Das and Swamiji. Namaste. Pranam.